Doctors of Reddit, what is the most unethical thing you have done or you have heard of a fellow doctor doing involving a patient? My best friend's mother, Rola, is from Lebanon. When Rola was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rola's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rola locked in a closet, waiting to presumably be sold into slavery. My roommate in dental school was a medical student. There was some big scandal at the hospital he was doing a rotation at because an anesthesiologist left the OR with the nurse anesthetist and left the patient alone. Something went wrong and the patient passed away on the table. Where were the two of them? Getting down in a nearby unused room thinking that nothing could happen in just a few minutes. This just sounds like the realistic version of Grey's Anatomy. It was in the news here, but there was a surgeon in Birmingham, I think, who diathermed, essentially burned his initials onto patients' livers. My colleague worked with him and saw him do this. I personally haven't seen much that's too bad. There are a lot of pretty dark jokes in the doctor's office but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection, but I politely refused. I want initials on my liver. In the hospital I work at, there are many frequent flyer psychiatric patients. They usually have very serious social issues. For example, lack of housing, no money, etc. Sometimes, when the psych unit gets tired of them, they buy them a bus ticket and send them somewhere far away so that they'll be someone else's problem. As a specialist who sees a lot of referrals, I see incompetence and laziness, which can be just as devastating, much more than outright unethical behavior. I'm a general surgery resident. We had a patient that had been on our service for about a year. Older fellow, very sick. Every now and then, he would go into respiratory distress, get intubated, or BiPAP, for a bit. Always would bounce back to his baseline of 8/10 sick. Everyone called him the Rock, but not in a cool "do you smell what the Rock is cooking" way. In a boring sick person that sits their way. Well, he had always been a full code. That means that in case of dying, we do everything we can to keep him alive. After a long time of being inpatient, my attending was sick of him and made him a DNRI, which means let him pass if he starts to struggle. He didn't want this, but they got away with it, saying that he did not have capacity, and he was decently with it, but I can see that argument. So talks with the family started and they specifically stated that they wanted full code. My attending didn't agree and decided to call them to confirm. But we think he purposefully called the wrong number many times and eventually decided for himself that he was DNRI. 2 days later the guy went into resp distress and died. I came to rounds the next morning to two attendings yelling and screaming about the right thing to do. Maybe I feel that it's better that he passed as well, but as his family's wishes were ignored and purposefully evaded, I could never go against someone's wishes. That is very unethical and illegal. If that happened where I work, the doc would be sued for sure. I once knew an OB who didn't like to work after about 5 PM, so at the end of office hours, if they had someone in labor, they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate tracing, justified or not, but the classic one would be that they would check the patient's cervix and lie about how dilated it was so it seemed as if labor wasn't progressing rapidly enough, and say, "I just don't think this is going to work, cut her, and be home for dinner." Now in OB we love TLAs, 3-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc we always said that they cut patients for CPD, cesarean, prior to dinner. No, I didn't report this doc because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a crappy doc even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed, that's what we're stuck with. You know, I've heard of this, but somehow this made it real and now I'm scared. I briefly worked as the front desk clerk for an ER at a local hospital. The rule was anyone that came in complaining of chest pains had to be back on a machine within 10 minutes of arrival. Once I entered their name into the system, a clock started, so I was told not to enter their name until they had already been taken back to essentially make our numbers look better and make it appear as though they were receiving care within the prescribed 10 minutes. People complaining of chest pains were typically brought back quickly, just not always within the 10-minute guideline, although generally faster than anyone else. This mostly seemed to be just about producing better stats, although keeping it off the system gave them the ability to delay. There are three kinda lies in the world: lies, damned lies, and statistics. My opinion: never trust an individual stat. They are almost always manipulated, and if you have chest pains, take aspirin. Did the same kind of thing when I used to work at Burger King. When it was slow, I'd get in my car, order a water, then drive around and do it over and over again so our times would look better. But yeah, this is different. Dr. John Story of Lowell, WY was convicted for the debauchery and physical shaming assault of many young women over the course of 25 years under the guise of pelvic exams. There's a book out about it. I was living in WY at the time, and the weirdest part about the whole thing was the way the town rallied around him and said he was innocent. I think he went right back to that community as soon as he was released. There were some legal shenanigans involved and I don't remember the actual outcome. Not a doctor, but a male nurse at a hospital I worked at was caught sodomizing male patients as they were recovering from surgery. That is horrifying. As a pharmacist, I will sometimes call docs on drug interactions. The other day, the doc I talked to had never heard of the interaction I was calling on and said to tell the patient to take the meds. I guess since you haven't heard of it, it must not be a thing. The ego on some of these guys is insane. I am currently a medicine student in Mexico. One of my professors told us that during his residency he works in hospital on a fairly poor area. In these sorts of places, birth control is a relatively unused practice, leading to poor families of 6+ children. In effort to stop this, they began to sterilize women during their children's birth regardless of their wishes. It's still a fairly common practice in the hospital. My father is a psychiatric nurse, and he will openly say how jaded he is by the incompetent people he works with. He has been employed as a registered nurse since the 1970s. But in recent decades the government has slashed the mental health budget, so instead of hiring qualified nurses who command a higher wage, they hire what are essentially babysitters with no experience. His patients are seriously mentally disabled, not the type who need to be put in a straitjacket and sedated, but grown men with the intelligence of 4-year-olds. These babysitters know nothing about restraining them when they get violent. They just cower in the corner and wait for the 1 or 2 nurses in the building. There's also a lot to be said about the character of these babysitters. My dad told me about one patient who had a phobia of cicadas. So this colleague thought it would be funny to catch a cicada and chase the poor patient around the grounds with it. The worst case of incompetence he told me about happened at this hospital that was located within walking distance from a major 6-lane motorway. 2 nurses came in for their night shift. Patients are sleeping, so workers on the night shift will watch TV or do anything else to keep themselves awake during quiet periods. These guys had brought in computer equipment with the intention of repairing or building a computer. I don't know. The fact was that they were so engrossed in their task that they failed to notice one patient who had woken up and left the premises. It wasn't until emergency services showed up and told them that there had been a fatal accident on the motorway that killed this patient that these nurses realized anything was amiss. Neither of them got sacked thanks to the strength of the nurses union. My grandfather was a physician in a small town and also worked as the pharmacist, as this was how it was done in rural areas. He lost his medical license for trading medication for carnal services from patients. He was a brilliant doctor and graduated top of his class from Dalhousie, but was a weirdo. When I was younger, he was also arrested for smuggling drugs into Canada. Female colleague cardiologist grabbed a sedated man's dong while he was undergoing surgery. His dong was massive and she grabbed it to show us. She also measured it. On a related note, her husband was a judge who had to resign due to a gender-based harassment issue. Very strange couple. No kids, a lot cats, and they drive a Subaru. Everyone in Colorado drives a Subaru. They're good cars. The other part of your story is messed up though. I'm a physician and used to work 12-hour night shifts at this hospital in California. My co-worker, who was also a doctor and admittedly a young and good-looking fellow, and I covered pages from different floors. If there was nothing going on, I would usually be in my call room reading, sleeping, watching TV until a nurse would page me for a problem. My colleagues on call room shared the same wall with mine. One night, I was reading in my room when I started hearing my colleague and another woman fricking, and the noises started getting louder and fairly difficult to ignore. Sorry, but she was pretty loud. Then, in the middle of this charade, I heard his pager go off several times without him answering it. Eventually, I left the room and called the hospital operator. I asked her who had paged Doctor, my colleague's name, and then called the nurse who was trying to get in touch with him. Turns out, the page was for a patient that was in a serious condition and had to be taken to the ICU. I took care of everything and went back to my room. Later on, I told him that they were paging him for a critically ill patient overhead and that he must have fallen asleep. I didn't say anything about hearing his Allegro chamber fricking orchestra, but I think he knew that I knew because he got red and thanked me for covering for him. You can't fool me. This is just the 4th episode of Grey's Anatomy. A doctor dang near killed my wife once. She'd been experiencing severe heartburn-like pain for several days, not responding to antacids or proton pump inhibitors. We went to the ER, where the doctor insisted I stay in the waiting room, and not only failed to take a history, but actively stopped her from giving one. He took an ECG, which was normal, and bundled her out the door with a spoonful of xylocaine viscous, a script for more PPIs, and instructions to see her GP in a week. A few hours later she was literally writhing in agony, so I said frick this, and took her to a different ER across town. The doctor there actually asked questions and listened to answers. He wheeled out an ultrasound, said whoa, and booked her in for an emergency cholecystectomy on the spot. The op took twice as long as expected. The thing was so swollen they had to drain it for ages before they dared move it. The surgeon later told her that if she'd waited even a few more hours, it would most likely have burst, with hard to survive consequences. I don't care about missing a diagnosis. That can happen to anyone. But missing a diagnosis because you will not let your patient give a history. Frick, that's so hard. From a patient perspective, I still have trouble with this one. I was getting a severe wound on my shin cleaned off debris with a scrub brush. The doctor for some reason wasn't wearing any face protection and managed to splash wound juice into her mouth. Her response was a PFFBTPLBBFTPBFFFTT. I got your juices in my mouth. I was horrified. Never returned. I would have found this hilarious for a while before realizing how terrifyingly incompetent it is. Veterinarian. I have worked with clients to hide abused dogs that were rescued from their mean owners until a shelter was located. I wasn't expecting this unethical act to be so well received. Thank you for all your kind words and for the gold. As long as I have a place to put an unwanted pet, I will continue to do what I can. Thank you to you all who have already adopted from a shelter or have taken in a stray. Even if you have paid a lot for your pet, as long as you love it and take good care of it, that's what we should strive for as humans. I was looking for someone like you a few months ago. Not me, but my mom worked as a nurse in Brazil for a while and said that the doctors at her hospital would sleep during night shifts and it'd all be up to the nurses. They would get angry if they were awoken and wouldn't take the nurses seriously, which led to this one guy's death. Despite my mom insisting that they check on him because he looked bad, because they didn't want to get up. By the way, this was in the 80s or so not sure if things have changed any by now. Sleeping on night shift is okay in some situations. If everyone is stable and sleeping, and I'm on a 15-hour shift, frick yeah, I'll sleep if I can. But if you get woken and asked for a view you don't be, you go do it, all the while feeling lucky you could get a little kip in. Med4 student here. During one of my internal medicine clerkship in a small hospital, I get paged to a cardiorespiratory arrest in the cath lab. I arrive there and a whole team is already working a way outdated ACLS protocol on a patient that was undergoing PTCA earlier. Apparently the interventional cardiologist has just placed a stent and was withdrawing when the patient had the arrest. After 40-45 minutes of resuscitation the patient did not pick up, so I was expecting them to just announce the time of death. That's when it gets unethical. The whole staff agreed to just send the patient to CCU, knowing he's dead, intubated on ambu bag, with a monitor showing a nurse's pulse and oximetry, and to tell the parents that the intervention was successful and that he needs observation before being discharged to regular floor. The patient was kept in the CCU and the staff would tell the family gradually that he was getting worse, and 2 hours later, they told them that he just died because couldn't tolerate the procedure. All this to protect the cardiologist and so that he keeps a good reputation and record. After I asked around, they were apparently doing this for every arrest that would happen during catheterization in this hospital. Definitely saw this as a nursing student in the OR, specifically one doctor, who'd operate on the ancient patients that no one else would touch, without special precaution. They'd all die in recovery, never on the table. We started scheduling the fragile ones for days he wasn't there. My stepdad is a dentist, had a boss, who was a fellow dentist, that was doing fillings on teeth that did not have cavities to generate more money. My stepdad blew the whistle and started his own practice. My great grandpa was a doctor and he used to say that he could guess the gender of a baby, but he'd write one thing on the chart and tell the parent another so if he was wrong he could tell them they heard him wrong. That doesn't seem that unethical to me, it's grandpa shenanigans. I'm not a doctor but a friend of mine's dad got diagnosed with colon cancer a while ago. They treated that and then the cancer spread to his liver. He had an operation to remove 60% of his liver but not too long after the procedure they found cancer in his lungs. But here is the twisted part. He went to a different cancer center following the procedure, and they found that he had cancer in his lungs all along. That's right. It said on file that the hospital he went to previously knew he had colon and lung cancer at the same time, for 3 months, and were never going to tell him. They intentionally were keeping it from him. The man is interested in pursuing a lawsuit. I for one think the whole situation is awful. The cancer center said had they treated the colon and lungs at the same time, he would have been better. I'm not a doctor, but I do work at a methadone clinic. I provide services. I had a client that was on 250 milligrams of methadone and continued to use H and Benzos regularly, like in the parking lot. He overdosed once in my office and another time in the lobby. We've called the ambulance on this man 4 times. He's been doing H for 28 years. We continued to up his dose and even phased him. He still tested positive for everything. I felt like it was unethical. I'm harm reduction based, but this was insane. It was like we were passing him candy at a parade. We had no idea if he was even taking the methadone. He was most likely selling. The fact that after he overdosed in my office, yet we didn't encourage him into an inpatient facility was the most unethical thing I've experienced. Harm reduction treatment doesn't work for everyone. An OB in MD was caught wearing a secret camera on his jacket and filming his patients' lady parts without their permission. When he was caught he went home and killed himself. The worst thing I've heard of a doctor doing. My mother says that while she was an intern at a hospital, a doctor didn't deliver a baby properly and ended up breaking the baby's neck. He and his supervisor tried to get my mother to take the blame, since she would only be reprimanded while he would lose his license. She refused. Hardly unethical but weird. I was trying to get a diagnosis on discomfort in my balls. Doc didn't wear a glove when he made his inspection. Totally smelled his fingers when he thought I wasn't looking. When I was a young kid and first discovering the joys of Google, I thought it would be fun to search my surgeon father's name. One of the first results led me to a tabloid article about a nurse who was operating within his department, who kept killing off patients in some twisted angel of death perceived mercy killings. I was 9. My doctor acquaintance bragged about making out with one of his patients immediately after she told him about being domestically abused. What? Boy, this story needs to be fleshed out, although I'm sure I'll regret asking. My mom worked in a pediatrician's office as a receptionist. Their doctors had special codes for chart notes. But ugly baby. They had more for things like noting the mom was an insufferable bee. I don't remember specific abbreviations, but I can ask my mom later. After working in a pediatrician clinic during my medical student rotations, I will have to say that knowing which parents are challenging before going into the room is a good thing. Kiddo still gets the same treatment, but the way I interact with the parents will differ. This happened when I was a medical student working in the air. This 20-something male was drunk driving and crashed his car into an elderly couple, causing them to require emergent surgery. He was belligerent and walking around naked in the trauma bay. Nurses were trying to get him to calm down and stay in his room and stop yelling. He was calling the nurses B and asking to go to the bathroom, so they gave him a urinal. As he was urinating, my attending went up to him and said, "I want you on that bed right now." He said, "Frick you," so my attending knocked the urinal out of his hand. Pies went flying all over the room. He picked him up and threw him on the bed and pushed some rocuronium through his IV to paralyze him. Then he seemed to take his time with intubating him, letting his O2 sat get down into the 40s before finally letting him breathe again. I don't know what ended up happening to the guy in the long run. Turns out he had just broken up with his girlfriend and went on a drinking binge. He deserved to be punished for what he did, but I don't think he deserved to be forcibly intubated for no reason other than causing a scene. I've broken up with a few girlfriends. Usually, I quietly sit at home and consume nothing but wine and pizza for a week. 2. If I really loved her, at no point did I get shithoused and put 2 senior citizens in the hospital and then cuss at the medical professionals trying to attend to me. This was really a misunderstanding, but in college I thought I had an STD. That turned out to be a recurring case of a yeast infection I got from some fine young lady. The culture would come out negative for any STD, but the symptoms would return. The college doctor was a woman, and after my 3rd time to return to tell her the symptoms were back even though the tests were negative and I had taken all the meds, she turned me away because she thought I had a weird fetish of her giving my Johnson a culture test. Not a doctor, but a cousin of a bandmate came to a festival with us and proceeded to drink 2 bottles of whiskey. Neat. Jump over a campfire with an axe, kick over a pushchair with a baby inside, and fall on top of it, and have a blazing row with the mother before passing out halfway into his tent. We were woken up by security asking if we knew him and what time he would be awake so they could kick him out. Following an extended period of guard duty, he was woken and evicted, at which point he decided to drive home to get ready for work as a doctor the next day. It seems children at festivals is a subject people feel passionate about. For the record, it was a relatively family-oriented festival. Read New Age Hippie, UK, but I also have major concerns about the number of unsupervised children at the festivals I've been to, and the level of frick their responsible adults are. Festivals can be an amazing experience for children and families, but picking the appropriate festival and being a good parent, i.e., not getting fricked, making sure your child is safe and having fun, is important. Maybe he was a rug doctor, and he was steaming mad at dirt. I had what I thought was pilonidal cyst, large cyst that forms at the top of your butt crack. I was in a lot of pain and couldn't even sit down. Went to the first little doc in a box urgent care center I could find, and they deemed it a really bad ingrown hair, but agreed to my pleas to lance it to relieve pressure. I'm rather hairy, like, my hairline starts at my forehead and doesn't stop till my ankles. In many people's eyes, not a pretty sight. I may mention that at the time of my visit, it's like 0730. First patient of the day, me and my giant ingrown follicle on my hairy butt. How the poor doctor and her nurse had to start their Monday morning. I go into the tiny OR, strip down, put on a gown, and they come in and get to it. I bled profusely, EpiPen be damned. My entire butt, crotch, and lap area were completely covered in blood and pus. The ingrown hair was massive, and formed an L-shaped pocket that was putting pressure on my tailbone. They stuff medicated gauze in the cut, toss down a handful of wet naps, and very coldly and dryly tell me to get cleaned up. They're done. After feeling a bit humiliated to begin with, it takes me a good 10 minutes to clean myself. The doc and her nurse walked back in on me completely naked, twice, only to sigh and give a snarky comment like "not done yet," while rolling their eyes. I couldn't get out of there quick enough. I know I wasn't a pleasant patient and all, but they made me feel horrible. I was in immense pain and needed help, fast. I wasn't expecting sunshine and rainbows with my issue, but I wasn't expecting horrible bedside manner and a total lack of respect either. More recently, I had to have an EKG done at the VA doc's office. The 2 nurses came in and had to shave patches out of my chest and side. I could tell they were trying not to laugh. As they left, Before the door even closed behind them, I heard them both burst out laughing in the hallway. My doctor looked mortified, and I shared the sentiment. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.